Hello, today we're going to be talking about fibrodysplasia ossificans progressiva, or abbreviated as FOP, otherwise known as Stone Man syndrome.
First off, let's talk about what Stone-Man syndrome is. It is a disorder in which muscle tissue and connective tissues such as tendons and ligaments are gradually replaced by bone. Imagine your skeleton replacing your muscles and you not being able to do anything about it. Here are some pictures of people who have this disorder. This is the rear view of the skeleton and you can see the extra bone growth. Here is a frontal view of the skeleton. You can see the muscles turn to bone around the humerus.
So what causes Stillman syndrome? Stillman syndrome is a mutation of the ACVR1 gene, which is located on chromosome 2. This mutation is caused by an abnormal activation of the ACVR1 gene that turns muscle into bone.
I'm sure that by now you're wondering, how do people get this? I just want to let you know, do not worry, or worry some. Stone Man syndrome is inherited in an autosomal dominant pattern, meaning that you only need one gene to cause the disorder. This disorder happens at random, so there does not have to be a history of this disorder in your family. Only in a small number of cases has it been reported that the mutation was passed down from parent to child.
The chance of you getting this disorder is 1 in 2 million people, and only several hundred cases have been reported. Since the disease is so rare, the symptoms are often misdiagnosed as cancer or fibrosis. This leads physicians to order biopsies, which can actually exacerbate the growth of these lumps. However, those born with FOP tend to have malformed toes or thumbs, which help distinguish this disorder from other skeletal problems.
Due to the lack of knowledge of Stone Man syndrome among doctors, the rate of misdiagnosis of the disease is estimated at 80% or higher. These errors in diagnosing FOP have caused pain and suffering for FOP patients and their families worldwide. For instance, misdiagnosis has led to unnecessary invasive procedures such as biopsies, as well as permanent complications from medical interventions, including loss of mobility. The reason why FOP or Stone Man syndrome gets misdiagnosed or confused with cancer is because often tumor-like lumps appear suddenly.
Here are some things to look out for, that way you're more informed. Children born with FOP have deformed big toes, possibly missing a joint or simply presenting with a notable lump at the minor joint. As you can see, the two big toes point inwards towards the foot. The first flare-up usually occurs before the age of 10. Specifically, FOP involvement is typically seen first in the dorsal, axial, cranial, and proximal regions of the body. This disease spreads towards the rest of the body. Here is an example of a flare-up.
Unfortunately, there is no cure. Doctors have tried to remove the extra bone growth through surgery, but the bone has just grown back. There's nothing really much that they could do to help him out. But fret not. There is ongoing research as well as medicine that relieves some of the symptoms such as pain and inflammation. There are many agencies, groups, and organizations working towards a cure, so hopefully one will come up very, very soon.